My name is Mia Geisinger, and I'm honored to be a candidate for Secretary Treasurer of your AAP. I appreciate the opportunity to introduce myself and my candidacy to our members. A little bit about me. I completed my undergraduate study at Duke University, received my dental degree from Columbia University in New York City, and completed my certificate in periodontology and implantology and my Master of Science degree from the University of Texas Health Science Center in San Antonio. After completing my studies, my husband was stationed in Fort Campbell, the U.S. Army, and I was in private practice limited to periodontics outside Nashville, Tennessee. When my husband completed his commitment to the Army, we moved to Birmingham, Alabama, and I joined the faculty at the University of Alabama at Birmingham. I've been at UAB for 14 years and have served in multiple roles, including predoctoral periodontal program director, director for faculty development and support, and currently as a professor and periodontal program director for our residency program. And I continue to treat patients in practice. I'm a diplomate of the American Board of Periodontology and have served the members of the AAP in a variety of ways. I have served on the board of directors and as president of the AAP Foundation. I'm currently a trustee to the AAP from District 3, and I also serve on the executive committee of the Southern Academy of Periodontology. I'm the immediate past chair of the American Dental Association's Council on Scientific Affairs. And lastly, I have served on over 20 plus AAP and AAP Foundation committees and task forces. And of course, my most important role is that of mom to one daughter. My goal in running for this position is to serve our profession and improve the environment for periodontists and periodontal patients. My role at UAB involves preparing new periodontists to allow them to achieve success in their practice. It is an awesome responsibility to help new periodontal colleagues hone the clinical, diagnostic, and communication skills that they will use in their day-to-day practice. And I'm so proud of the successes of all of our graduates. I also understand that their practices and the environments in which they practice continue to evolve. At the AAP, it is critically important that we continue to work to create and encourage an environment that sets up all periodontists for success, while providing member value and advocating for periodontists and periodontal patients. While the challenges we face are significant, as an academy, we also have considerable opportunities to create a roadmap for success for both our academy and our members. I feel that my previous broad base of experience and work in organized dentistry will help me to serve the variety of stakeholders within the AAP and the periodontal community. The stated mission of our academy is to champion member success and professional partnerships for optimal patient health and quality of life. And I think that focus on patient health and quality of life is a timely opportunity. The current COVID-19 pandemic has highlighted how important the work we do is. And I see my role within the Academy to be the voice of our members and to work on their behalf to highlight the critical role that we all do to care for our patients. I also believe that when we talk about member success, that looks different for a variety of individuals, but our academy can serve as a resource to provide our members with the tools to improve their day-to-day practice. I'm interested in promoting several initiatives that I believe are critical to the long-term viability of our academy and will improve practice environments for periodontists. First, the COVID-19 pandemic and the emerging focus on wellness and the risk of chronic inflammatory conditions offers a huge messaging opportunity. Emerging evidence suggests that periodontal disease increased the risk of death in hospitalized COVID patients by nearly 9-fold. This is not an oral systemic connection, but a periosystemic connection. And we can leverage the momentum and in particular engage our dental hygiene colleagues to carry this message into the offices of our general dentist friends. With the recent ADA endorsement of our AAP diagnostic classification system, which was requested by the AAP while I was chair of the ADA's Council on Scientific Affairs, who then vetted that endorsement, we as periodontists have an opportunity to reach out to hygienists who are keenly interested in this new system and deliver our messages to them. And I have been doing just that through my work with the American Dental Hygiene Association, Inside Dental Hygiene, and the Canadian Dental Hygiene Association. Next, early in the pandemic, our Academy's breadth of experience and its reliance on science were highlighted. And the COVID-19 webinars that reached all of us at home were critical to keeping so many of us engaged and involved with each other and with our Academy. I was grateful that I could be of service and involved in that webinar series, and so grateful to the Academy for providing so much valuable information. As we move into our next normal, continuing to focus on science and digesting and creating digital messaging that can be used by our membership to promote their expertise, the science behind what we do, and the value of our specialty is critical to creating a toolkit for member success. I currently serve on the AAP's Task Force for Future Science Strategy and believe that understanding emerging technologies that will impact our practices and emerging science can change the way that we do business in periodontics, and it's critical to our success in the future. Many organizations were forced to pivot at this time and develop alternative revenue streams due to the pandemic. As we move forward, development of additional non-dues revenue sources, including industry partnerships, digital continuing education delivery, and digital and print content licensure, will allow our Academy to reduce the financial burden on members and will create additional funds that can provide strategic programs that serve our membership. At the ADA, I chaired the ADA's SEAL subcommittee for 2 years and oversaw the doubling of non-dues revenue related to the ADA SEAL in my time on the Council on Scientific Affairs. I believe that our Academy has the opportunity to expand current funding sources and diversify our revenue portfolio with strategic investments that will pay off moving forward. Membership recruitment and retention is critical to the vitality of any organization. Given the AAP's robust response to the challenges of 2020, including the AAP webinars, AAP's work with other dental associations, and the pivot to an all-virtual meeting, the value of our AAP membership was well demonstrated. But recruitment and retention cannot be one size fits all. Specifically targeting individual demographics, including new members, and providing programming individually geared towards them is necessary to establish the AAP as a professional home. As a member of the newly formed Membership Sustainability and Growth Committee, I know your AAP is keenly focused on providing value to these specific groups. I believe that the AAP should provide resources to aid in practice transitions. This would benefit those who are entering practice from residency and also those who are moving to a different career path, whether that be retiring or entering a new professional phase, and will allow our Academy to demonstrate our value at a stressful time. Further, I think that we have to engage younger members through social media and develop bite-sized virtual content to provide on-demand information with the weight of the Academy and its expertise behind it. Like many of us in our practice, I am not only a periodontist and an implant surgeon. We are all entrepreneurs, educators, communicators, mentors, patient advocates, scientists, and innovators. We work to deliver high-quality, patient-centered care in conjunction with multidisciplinary dental teams. My day-to-day job allows me to wear all of these hats and also to work with educators, scientists, new periodontists, and master clinicians across the United States and the world. And this has allowed me a unique perspective to understand the varying needs of our diverse membership and to work to address those needs for our members. Further, I have worked in organized dentistry throughout my career and have been involved in many different dental organizations, which has offered me the opportunity to see different leadership style and identifies qualities of an effective leader and of successful organizations. I feel that all of these experiences have served to prepare me for a leadership position within the AAP. 2020 was a roller coaster year for periodontists and patients alike, but it has also highlighted the importance of engaged, passionate, and innovative leadership. The AAP is a strong, vibrant, diverse organization, and its greatest strength is our members. It has been an immense honor to serve on the Board of Trustees with my colleagues, our leadership, our amazing AAP staff, and to work alongside countless periodontist members who make our Academy so incredible. In seeking the role of Secretary-Treasurer, I will continue to work tirelessly to advocate for our members, our Academy, and the future of our profession. Thank you for your consideration, and I respectfully ask for your vote for Secretary Treasurer.